move to our next lecture, I would like to welcome Dr. Nada Yasin Fida. دكتور ندى is a life coach، مستشارة تدريب وكوتش تحسين الأداء، مديرة التدريب والتواصل بقسم تجربة المريض في مستشفى المركز الطبي الدولي IMC، نائبة رئيس جمعية سفراء التطوع في إحسان، حاصلة على دراسات عليا دكتوراه في إدارة الجودة وإدارة المستشفيات. دكتورة ندى, she will talk about today about the compassion as a foundation of the patient-centered care. Welcome دكتورة ندى.
أهلا وسهلا بالجميع وشكرا لاستضافتي معكم في هذه الندوة المصغرة وتحية للجميع. حبدأ من يقولوا دائما نبدأ من حيث انتهى الآخرين. حنخرج شوية عن الطابع اللي هو الطبي والكلينيكي للنون كلينيكال بيرسونز وقد إيش النون كلينيكال تكنيكس أو موديولز بتساعد الطاقم الطبي أو الرعاية الطبية سواء من أطباء أو من تمريض إنه يقوموا بالخدمة حقتهم and to serve the patient in the best way. I'll start sharing my screen. Okay. So thank you again. Our topic today it will be about the compassion as a foundation of the person-centered care. As all of you know, that healthcare organizations are moving forward to elevate the services. So person-centered practice and compassion is an approach, and this approach focuses on taking steps to relieve the patient. السلايدز بتمشي مع بعض. How can we focus على البيبل نفسهم، على الكير. الناس هدول اللي جايين أو المرضى the patients are not only patients, they have their lives, their families. How can we focus on the person as a whole, not only when he come to the care. So أول حاجة نبى نعرفها اللي هو الcompassion. إيش هو الcompassion وليش نحتاج إحنا الcompassion في حياتنا أو في عملنا أو في كل حاجة، وكيف الcompassion ده حيساعدنا to improve our health services. So الcompassion هو feeling. كلنا نعرف the compassion is a feeling. الفيلينج هذا how to be with the other, suffering, and try to help him to move forward, to take a step forward, not to stay in that suffering. والcompassion نفسها it's a Latin word جاية من كلمة we suffer together. We have different feelings ممكن نتعرف عليها. دايما إحنا نسمع empathy or sympathy أو compassion. لو جينا نفرق ما بين كل واحد فيهم how different are they. الsympathy اللي هي understanding the other people feeling. So يجيك إنسان مريض تعبان زعلان whatever تقول له I can understand you، أنا أقدر أتفهم الحالة اللي أنت فيها. الempathy لا أنت تحس it's about feeling. I feel you, I sense you. لكن الcompassion اللي هي step forward زي ما إحنا قلنا هي kind of الsympathy والempathy ناخدها لأعلى اللي هي I'm with you، تاخدها للأكشن step. فعشان كده الcompassion هي الأمبريلا اللي أعلى. فزي ما احنا شايفين هنا كيف الأمبريلا بتكون فوق I moved by you، أنا موجود. وعشان كده الcompassion ده لما نبدأ نطبقه إحنا في حياتنا هنقدر نطبقه مع our patient في الهيلث كير. Why so important to start with ourselves? Self-compassion. Because if you don't care about yourself, you cannot care for others. And this is the main thing. And that's why clinicians or caregivers get burnout so quickly. Because you cannot, be empathizing or compassionate with others all the time. But they are patient. So you have to take care of yourself first. So usually I ask people to start with self-compassion, to feel warm and understanding with themselves first, to care. So if I have a feeling, if I have suffering or a failure or something, I need to understand why is that happening, and pamper myself and take step with myself, and to let go that thing, not to ignore the feeling and not to judge and criticize myself. If I really understand how to do the self-compassion, and there's different techniques for that, part of it, the breathing technique, the yoga techniques, and step forward, meditation is number one for that. So start compassion with yourself first, then we can do it with other persons. So Dr. Kristen Neff, the founder or the mother of self-compassion, gave us 3 elements for compassion or for self-compassion, starting with the self-kindness, not to punish yourself, but to understand it. Then the sense of common human, which is humanity, that everyone is going through something. So it's not only me. And then to be more aware, mindful, not to ignore the feeling, not to exaggerate the feeling, being aware of what I'm suffering, of what I'm feeling, and not to judge myself or criticize myself. So first of all, being kind, humanity, and being mindful. If we manage to start with ourselves, as I said, we can do the compassion with the patient and then move to the person-centered care approach. So how to give compassionate to the patient? Now, if we start with ourselves, as I said, and I know, as you see in the last point here, take time to care for you, for your own emotional needs. So first of all, this is the most important time. I have to take care of my emotions, not to get burned, okay? So if I manage to do so, I can practice the good manner with the patient and their families. I can show personal interest to the people I care. And I can think about what they are going through or suffering, so I can feel them, I can act with them, I can take them step forward. And I need to acknowledge the feeling. So if let's say, one of your loved ones have a severe headache or a migraine, and you try to care for him and to pamper him, you have to acknowledge the feeling he's going through or she's going through. This is the most important. This is the care what the patient needs or the family or the loved ones need from us. And we cannot give it unless we give it to ourselves. So when we come to the person-centered care, as I said, our topic is to talk about the compassion and the person-centered care, and to prove that compassion is the foundation of the person-centered care. For all caregivers or for all healthcare institutions applying the person-centered care model, compassion is the number one you need to apply first. So as you can see, person-centered care is caring about the patient and your loved ones, caring about the staff, and caring about the community. So it's the whole thing. It's not only the patient and the loved ones, it's not patient first. Usually, we agree that patient comes first, but we have to balance between the caregivers and the community and the patient. And that's what we are going to do now. So it's the way of thinking, the way of doing things. How can we make sure that everyone, people use healthcare, are equal partner? We treat them as equal partner in planning, in developing and monitoring, making sure that we cover all their needs. So they are not visitors, they are not only patients, no, they are our partner in healthcare. Also, the WHO identified the person-centered care or person-centered practice as empowering the people to take charge of their own health rather than being only passive recipients of the services. Just imagine patients come to you and you just treat him, give him the medication, tell him you will feel good, and that's it. But try to engage him more. So how is that? One of the key is to involve the patients. It's involve them by improving the interactions, the communication between healthcare providers and the patients by using or caring, feel empathetic and compassionate with them. So to accomplish and to go step forward in this module, we need to talk to all the healthcare providers, from physicians, nurses, any staff. We need to train them how to listen, how to consult the patient, how to take them through the steps of all the healthcare continuum. So it's to make sure that their values matching with we are on the same goal. As we can see here in this diagram, the mission and values of our healthcare must be aligned with the goal of the patient. Why is he here? Using collaboration and coordinated to access their needs. Comfort and emotional well-being must be top of our priority. Transparency must be fast in delivering information. Also, their family, they must be welcome in care settings. Include them in our decision. Take their point of view in consideration. So they are the core, the patient and the families, they are the core. So understanding from all of those, there must be a cultural shift. So it's not like we used to be. No, we need to change lots of things. Patient-centered care or person-centered care requires a shift. How the providers' practices or the healthcare systems are designed and managed. So it's not this shift. It's not only happening like we used to be, that all healthcare providers or physicians or clinicians are they have the authority by themselves. No, it's everyone, starting from the parking valet to the every environmental services staff, to the nurses, to the C-suite members. We must engage everyone in the process. And that impact in hiring them, training them, the leadership style they are using, and organizational culture. So the shift must be there, but it needs to practice. It needs lots of effort to be done. In this diagram or in this slide, we can see that the building blocks start from the dialogue or from the engaging or from the reflecting question we use with our patients. And then how to understand them, how to understand their need as individuals, involving them and involving their families, their friends with them, shared goal setting and decision making by using active listening and by using the empathy and compassion. So this is the steps how to build the block. To make it easier or to make it more understandable and touchable to every one of you, I'm going to share this video with you so you can really see how person-centered care and compassion are very important in our healthcare organization these days.
دكتورة ندى الفيديو ما في بصوت.
اوكي حاضر. اعتقد في الشيرنج دقيقة معايا.
6 minutes sharing. Share sound.
I need a guide here. Sounds it's open, but maybe it's not shared of the video.
من أيقونة الشيرنج يا دكتورة ندى الأساسية.
اوكي حاضر.
اضغطي عليها من جديد وشير ساوند ويضبط إن شاء الله.
اوكي. Yes, I got it. اوكي، اعتذر الجميع ومشاهدة طيبة إن شاء الله.
Around the world, people are living longer, but often with multiple diseases and conditions that require care over many years. And unfortunately, too many people Around the world, people are living longer, but often with multiple diseases and conditions that require care over many years. And unfortunately, too many people are not informed or consulted in the care they receive. In some countries, only 1 in 3 people have the risks of their treatment explained to them. 1 in 5 people have at least one unnecessary test. And up to 40% of health spending is wasted due to inefficiency. Healthcare should not be like this. Remember, people live with their condition 24/7, not only when they seek care. That's why people-centered care is so important. People-centered care means ensuring that health services are tailored to people's needs and are provided in partnership with them rather than simply given to them. It means care where people, families, and communities are respected, informed, engaged, supported, and treated with dignity and compassion. People-centered care can have lasting benefits. It improves the trust, experience, and outcomes people have and are provided in partnership with them rather than simply given to them. It means care where people, families, and communities are respected, informed, engaged, supported, and treated with dignity and compassion. People-centered care can have lasting benefits. It improves the trust, experience, and outcomes people from care, the confidence and job satisfaction of health professionals, and the quality and efficiency of health systems. People-centered care can increase access to health services and reduce unnecessary use of services. Ultimately, it means people get the right care at the right time and in the right place. But too often, this type of care is not standard practice. Implementing people-centered care requires fundamental changes in our approach to healthcare. It means rethinking how health services are organized, managed, and delivered. It means shifting away from asking, "What is the matter with you?" to "What matters to you?" Around the world, the World Health Organization is working with countries to design health systems that put people and their needs at the center of care. Because that's the healthcare that everyone deserves.
That's the healthcare that everyone's deserve. أتمنى إن الفيديو كان واضح جدا قد إيش مهم using a person-centered care، قد إيش مهم using a compassion in dealing with the patient, and how can we engage them in everything and make life easy for them and for us. So from this slide, it shows the healthcare facility. Let's say it's a hospital. So there is lots of positive changes and benefits in achieving the excellence in person-centered care. As you can see, maybe الكتابة ما هي واضحة، بس خلينا نقول إنه هنا more connected communities, healthcare, more delicious food you are serving, increase in employee satisfaction, responsiveness of the staff. Everywhere, more engaging staff, better communication between nurses and doctors, better pain management. So there's lots of benefit in using the person-centered care, like improves the quality of life, supports independence, promote well-being, enhancing dignity, honors choice, lots and lots and lots. So what can I say more about the person-centered care or about the compassion? A compassionate system of support has the potential to help professionals to navigate the context without losing own selves in the process of enabling person-centered compassionate practice to thrive. And by that slide, I end my presentation, and thanks to all the audience who's been with me here, and I'm ready to receive any questions, if any. Thank you.
Thank you, Dr. Nada, for this interesting lecture. I would like to ask the attendee and the audience if there is any further question regarding the slides.
May I allow me to put a question, please?
Sure,
You hear me,
تفضل.
دكتورة ندى؟
أيوة تفضل.
يعطيكم العافية ما شاء الله تبارك الله. Excellent, super presentation. And especially the video, really, I enjoy. I remember in my time used to work on what we call patient-centered care, but now you make the circle bigger, reach the people-centered care. And how far we are from practical issues here. The theoretical side is excellent, but how far from the practical side? Are we really doing what is really in? Are you achieving what is in your expectation? Are you achieving your goals?
Okay, thank you, Dr. Ahmed, for your questions. It's achievable, and I can see it there. It's not theoretical part. There's an organization in the state applying the person-centered care and accredited the make accreditation for healthcare organizations and helping them to apply the person-centered care model. And we have started in our organization, we have started to apply the person-centered care. It needs lots of effort and lots of changing in the mindset, as I said in the beginning, the way of thinking, shifting. And we are applying some of the training courses for all the clinician, nurses, all care providers, and even the administrative people, how to change the way of thinking, the mindset of the regular thing or from the patient-centered care to the person-centered care. It's not easy, and nothing easy when you apply it since the beginning. Achievable? Yes, it's achievable. And we have started in the coming, I believe maybe the next month or the after Ramadan, people are coming for doing the gap analysis in our organization to check how so far we are applying and to give us some guidelines to do. So if any organization would like to start, they can start. And there's lots of training to apply that. And I believe that MOH or all, if OH are moving, so I believe everything is moving. And we have seen so far lots of changes in the healthcare organization, the facilities, the care providing and giving, الخصخصة. So yes, everything is achievable. It takes time. I hope I answered your question.
Yeah, you did. If you allow me also another question.
Sure.
I believe we work very, very much in the hospital, But are we doing the same effort in the primary healthcare clinics?
I can leave these questions to one of who's working in the governmental sector to answer, but I believe they are moving forwards because MOH step by step are moving with us in doing the patient satisfaction surveys with the press Gani. I believe the Dr. Adil Shaban, he's in the in that sector, governmental, and they're applying lots of MOH hospitals are applying that, seeking for the patient satisfaction surveys and monitoring the institution among the Gulf and I mean the Gulf. It's not only Saudi Arabia, even among the Gulf, the United Arab Emirates, Qatar, Bahrain. So each one who's in that organization, or shared with the Press Gani institution, they can see where they are standing and applying the step-by-step moving forward. So I believe there is moving forward in the primary care. I think they are putting efforts in there. How? I cannot answer because I don't. I work in a private sector, but I know that they are working hard because they are working with us as partners and moving forward or elevating the care provider.
Okay, if you allow me, final question, because I enjoy the talk. Do you put any model hospital, let's say in the private hospital, applying the personal?
PPC, personal sector.
Yeah.
Yes. Yes, we have modeling. We are modeling with Mayo Clinic in the state. They are applying that one. So دايما يقولوا ابدأ من حيث انتهى الآخرون. So we partner them and we see what they are achieving or how the steps of change they are doing, and we try to apply it here in our organization, making sure that it suits our culture, our beliefs, and manage it. Yes, there is modeling.
Okay, thank you very much.
Thank you.
Thank you, Dr. Nada. And now we will move